Here's a couple of other assumptions that are important for those of you who are dealing with this kind of behavior. The only person whose behavior you can change is your own. Right? We can't even change our kids' behavior, especially those of you who have teenagers, those of us who have teenagers. And for those of you who have spouses and partners, we know we can't change them, right? And why do I say this? Because I see leaders like yourselves all the time beating yourselves up because you're saying, I've done this, I've done this, I've done this, I've done this, and the situation continues. I must not be a good leader. No. The person who's exhibiting this kind of behavior is an adult and is making choices. You're not the one who's making the choices. You make a choice to behave however you are, and that person is making choices to behave how they are. But as a leader, what can you do? You can create conditions that can encourage other people to change. And how do you do that? By giving them information, motivation, and support. All you can do is create the conditions that enable people to change. The decision to change is up to the individual. As far as disruptive behavior is concerned, there's only two things you can do. Let's be clear. It's absolutely binary. It's digital. It's on-off. You can do something or you can do nothing. That's it. Something or nothing. And every time you're faced with one of these situations, ask yourself the question, do I want to do something or do I want to do nothing? Sometimes doing nothing might be a perfectly appropriate response. And by the way, we can have all the protocols and flowcharts and algorithms in the world, and there will never be a substitute for leadership, judgment, and discretion. You can have all the flowcharts in the world. It says first you do this, then you do this, then you do this. And those flowcharts and algorithms are a good guide, but they are not a substitute for judgment and discretion. And as much as we like the comfort, we love the comfort of the algorithm. We love the comfort of the flowchart. Because it's, oh good, this is what I do next. This is what I do next. And that's great. But always say, at any given point, your judgment and discretion comes into it as well, right? Am I going to do something? Am I going to do nothing? And what are the advantages and disadvantages of each approach? So very quickly, what are the disadvantages of doing nothing when it comes to this kind of behavior? Or what are the advantages of doing nothing?
It can escalate, and it may not. But
it may not, yeah, but it could escalate. So that's a disadvantage. What's an advantage of doing nothing?
Sometimes it allows the team at that level to try and step in and do something, and they solve their own problem.
Sure,
which is
absolutely, which is fine. What's an advantage of doing nothing?
It's easier.
It's easier for the leader.
Short run.
In the short term, it
run,
absolutely is
run,
easier.
not
Sure it
the long
is,
run.
yeah.
Well, it's a false economy of time. You think you're saving yourself time, but in fact, if these things do escalate, then it actually takes more time to deal with it.
And it goes back to that 80-20 rule we were talking about, right? You know, you have 20% of things taking up 80% of your time, or 5% of things taking up 95% of your time, right? So
it depends where you are in your term.
Yeah.
In your last, your last 6 months.
Yeah.
So it changes. We mentioned that yesterday.
Yeah.
It actually does change things.
Yeah, it does. It does. What are the advantages of doing nothing? One more. What are the advantages of doing
Behavior
nothing?
may go away.
It might go away.
Sometimes you don't have enough information at that point, so it's best to just wait a bit.
Listen, let me tell you, the number of times I have been burned over these many years because I didn't have the right information. I went and acted with incomplete information. I got scars on that one, right? So, you want to wait and get the complete, you don't want to hear just one side of the story, right? Another advantage of doing nothing is it's possible you might make a mountain out of a molehill if it's, So and these are the questions. There is no cookbook out there that will help you with that. It's going to be your judgment and discretion. And it's going to be conversations with your colleagues, right? See, one of the things I've learned about physician culture is I've learned that physicians are a little reluctant sometimes to reach out to their colleagues and say, what do you think, what do you think? And I think it's because, remember yesterday we talked about the culture, and some people talked about kind of the Lone Ranger kind of thing. And I wonder if sometimes physicians are reluctant to reach out to one another. And I know I'm making a huge blanket statement here, but I do see a little bit of that, because when I work with physician leaders, I'll often say, well, have you talked to your colleagues about this? What do they have to say? Oh, no, I haven't talked to them about it. Well, I haven't yet. And in many cases, it just hasn't occurred to them, right? Whereas on the kind of the administration side of the house, managers talk to one another all the time about their performance problems. They do all the time. They pick up the phone. You've got a nurse manager picking up the phone, calling another nurse manager saying, look, I got this issue here. What are your thoughts, right? That seems to be a little bit more of the way business gets done there.